Hello and welcome to Combat COVID-19 Community Support. My name is Dawn Creech and I'm leading up this effort here in Central Oregon. I'm really excited you've joined us today. We have a wonderful guest speaker, Dr. Travis Moshaw from endocrinology. He's an endocrinologist at Endocrinology Services Northwest, and he's going to be talking about managing your diabetes at home during COVID-19. But before we get started, I did want to talk a little bit about who we are. We are an informal coalition of healthcare providers and other community leaders in Central Oregon. We're working together on a series of live stream video events and virtual groups focused on how you can care for yourself and your family's health during the pandemic, and we're funded by the Central Oregon Health Council. I just wanted to give a really quick plug for some of the other events coming up next week. We have a great lineup ahead. On Monday, we have Stories of Resilience with This Topical Life podcaster, Tiffany Murphy. She's going to be doing a great interview with Carrie Faith. And then we have a couple events on April 16th. Immunity and COVID-19, that's going to be a big buzzword coming up with the new immunity tests that are coming out. And we have Dr. Laura Penavaria to talk about that. We also have one Thursday evening on, are you feeling depressed? You're not alone during COVID. And we have two behavioral health clinicians from Summit Medical Group that are going to be doing that event. And then on Friday, April 17th, we are going to have one specific for kiddos. We have a wonderful pediatrician, Dr. John Peoples, talking about what you need to know about kids and COVID-19. And you'll definitely have an opportunity to ask questions and get those answered. So I did want to invite you to like our Facebook page so that you get all the updates and you can view our schedule of upcoming live events. We also now have a YouTube channel, and you can view both live and the recorded events on either Facebook or YouTube. Now, before we get started, we have one more thing. My lawyer says we have to read this really boring disclaimer, so hold on, just bear with me for a moment. This event is provided for informational and educational purposes. It is not offered as medical advice or medical opinions. You should not treat this event as a substitute for professional medical advice or care. If you do require assistance with any mental health or medical issue, please contact your healthcare provider. We make no guarantees or warranties of any kind, express or implied. And with that, I'm going to hand it over to Dr. Moshaw. I did want to let you know that we probably have about 20 minutes of prepared content for you. Please feel free to type in any questions in the comment box, either on Facebook or YouTube, and I'll be monitoring them. And Dr. Moshaw has kindly agreed to answer some of your questions when he's done presenting today. All right, Dr. Moshaw, take it away.
All right, well, thanks for the introduction. So again, my name is Travis Moshaw. I'm an endocrinologist here in Bend, Oregon. And I'll just give a brief talk today about diabetes and coronavirus. So first, I just wanted to talk a little bit about the state of the coronavirus as it pertains to where we're at here in Oregon. So this is a slide from the Oregon Health Authority, and it's updated periodically. It was last updated just a little bit earlier this week. And what this shows is the number of COVID cases in Oregon per day. And so we can kind of see that starting in February, we started to get some cases, and they really started to hit their peak late last month. And now we're starting to see that curve kind of drop down. So as it says on the side there, when you hear the news people or even physicians talk about flattening the curve, this is what they're talking about, is dropping the number of cases that are happening each day. And really the curve started to flatten when social distancing really went into effect. So it's really important, especially for diabetics, to really maintain social distancing and really follow the rules that are in place. Wearing masks to the store, washing your hands, not touching your face, those type of things. We can clearly see from this slide and from many others that it does work. So, when there's a kind of a scary thing like this, it's affecting everybody. People want answers, and most people will go to the internet, which is very reasonable to try to find answers. But there's a lot of different, places on the internet where you can go with variable degrees of solid information. So where I direct people and where I go myself is American Diabetes Association. So if you were to type this into your browser, American Diabetes Association and COVID-19, you could find this page right here that we have in front of us. So you don't have to worry about writing anything down or anything like that. If you have questions, when you think about this later on and you want to kind of go back and look at it, you can just go back to this page and almost everything that we talked about today will be on this. So there's a lot more information than just this one sheet, but these are commonly asked questions, and so I thought this would be a good place to kind of frame our discussion and start our talk. So one of the most common questions that comes up in our clinic is, are people with diabetes more likely to get COVID-19? And it looks like that we're not. Diabetics are not more likely to get COVID-19. If we look at data from China and from Italy, we're not really seeing that. As long as diabetics are maintaining the precautions, the social distancing that the rest of the population is doing, then there's really not much risk above what the normal population would see. The second question, do people with diabetes have a higher chance of experiencing a serious complication from COVID? And the answer to that is yes, but it depends. So diabetes is a spectrum of disease. You know, we see patients that are young kids with type 1 diabetes that have very well controlled blood sugars. And on the other hand, we see older adults with type 2 diabetes with multiple comorbid conditions that are poorly controlled. And so their risks differ a lot. Younger kids probably have a very similar risk to the general population. As we get older and as we get more problems in addition to diabetes, like heart disease and hypertension and peripheral vascular disease, then your chance of getting a severe infection is much higher than the general population. So what I like to ask people to do is to get a game plan in mind before you get sick. So a few things to have on hand before you get sick would be, number one, hydration. One of the main things that happens to people when they get a viral infection and they have diabetes is they get dehydrated. You get a fever, you lose fluids that way, your blood sugars are high, you're urinating more, so it's pretty easy to get dehydrated. So I ask people to keep on hand things like chicken soup, has good electrolytes in it. Similarly, a sports drink with low carbohydrates would be a good choice. Water is fine, but something that has some electrolytes are nice to keep things balanced out. The other thing to have on hand are simple carbohydrates. It may seem a little paradoxical, but you're going to want to have something on hand like juice or candy, even regular soda to bring your sugars up. I'm fortunate enough to have only one patient so far that I've been diagnosed with COVID-19, but one of the main things that happened to her is that her appetite really went down, and we're seeing that pretty frequently with these infections. So people don't eat, and if you take your same medications, then it's possible that you get a low blood sugar. So you want to have on hand something that could rapidly increase your blood sugar. And then the third part of the plan that I'd like people to do is to make sure you have a game plan for your medications. So, what are you going to do with your diabetic medications if you get sick? Most of the time you'll want to continue your medications, but I think it's a good idea to talk with your doctor about what the game plan is. There are some medications, things like Jardiance, Invokana, Farxiga, those are called SGLT2 inhibitors. And occasionally doctors might have you hold those if you are going to get sick, because those medications might increase your risk of developing something called euglycemic DKA. So I think 3 pillars of being prepared would be having hydration, having some simple carbohydrates, and then having a good plan for what you're going to do with your medications if you do get sick. So the next question is, do I need to worry about DKA? And the answer is yes. If you have type 1 diabetes and you get a viral infection, then your chances of having DKA go up. That's why everybody with diabetes, but especially type 1s need to have a sick day routine. So just like we have a plan for before we get sick, we need to have a plan for once we actually do get sick. The vast majority of cases of COVID-19 can be managed safely at home. So it's important to have a sick day routine that you can do at home. So again, 3 things of the sick day routine, or 3 parts of the sick day routine. Number 1 is the same, is hydration. So you want to start drinking that chicken broth and that low carbohydrate sports drink if you get sick. That's one of the most important things, is not to become dehydrated. The second important thing is if you're on insulin, you need frequent blood sugar checks. That means checks every 2 or 3 hours. If you're on a continuous glucose monitor, then looking at that monitor frequently. And then the third thing is if you're on insulin, especially if you're on multi-dose insulin, then you're going to need to give that insulin frequently. So if you have type 1 diabetes and you get sick, you're probably going to need to give insulin every 3 or 4 hours to avoid DKA. One of the biggest problems that I see from people is if you get sick, you don't really feel like dealing with your diabetes, and you don't maybe give the kind of insulin that you need, that is just a perfect recipe for ending up with DKA and going into the hospital. So the next question is, what are the symptoms and warning signs I should be watching out for? And what do I do if I think I'm developing them? So, if we go to the symptoms for diabetics are the same as the symptoms for the regular population. If we go to the CDC website and kind of look at what the cardinal symptoms are, the cardinal symptoms are fever, cough, and shortness of breath. Now, those are the 3 main things, but there's a host of other symptoms that could come up, myalgias, fatigue, nausea, lack of appetite. If we look at the 3 main symptoms, it would be what I mentioned: fever, cough, and shortness of breath. So what do I do if I think I'm developing them? That's the time when we start to institute a sick day routine at home. So hydrate, make sure you're getting enough insulin and enough carbohydrates in. So what are the emergency warning signs, and what should I do if I'm experiencing those? So the emergency warning signs are really related to what we call hypoxia. That's a lack of oxygen in the bloodstream. So COVID-19 can cause something called an atypical pneumonia, which just means your entire lungs are involved with this viral infection. When your lungs are infected, then they can't adequately allow oxygen into your bloodstream. So when you have a lack of oxygen in the bloodstream, you will feel shortness of breath. You may feel chest tightness or chest pressure. You may feel confused, and you may notice some bluish tint around your lips. If you're feeling or having those symptoms, then you really need to go to the emergency room. What would be ideal if you could is to have a family member call ahead to the emergency room. If it's not a situation where you need to call 911, then have a family member call ahead to the emergency room so they'll be prepared for you to get there. They can have on the right gear, the personal protective equipment, and they can quickly get you to the right part of the hospital to get you taken care of. I talked to the hospital team earlier this week, and right now, St. Charles has plenty of capacity. They have a few cases in-house, but those people are isolated, and it's nothing like what you're hearing about, hospitals in New York or elsewhere in the country. So if you're feeling sick, don't be scared to go to the emergency room. They'll get you taken care of. There's plenty of equipment and staff at the hospital to take care of you. Now, are the risks different for people with type 1 diabetes and type 2 diabetes? The answer to that is kind of, it really depends more on your age and your comorbidities. So like we talked about earlier, if you're a young patient with type 1 diabetes, you have no other medical problems, and your blood sugar is well controlled, your risk of having a severe infection is probably not that much different than the general population. However, if you're a type 2 diabetic, you're a little older, you have other problems like heart disease or hypertension, then the risks are quite high. What should I do to prevent the spread of COVID-19 in my home? And what do I do if someone in my household has the virus? So to prevent the spread of COVID-19 in your home is just kind of common sense measures that we do all the time. It's washing your hands, it's cleaning the surfaces of your counters, of your cutlery, of your bathroom with effective cleaners. And that's the main thing. If you have someone in your household that has a virus, then they need to be in a more isolated area. Ideally, they'll have their own room and their own bathroom. And then just one person of the family should be taking care of them. The rest of the family should be staying away. Person that's taking care of them needs to be, social distancing as best they can, wearing a mask and washing their hands. And if you do that, it's not inevitable that everyone in the house gets this virus, but it is a contagious virus. I guess that reminds me, I skipped over that question. Is COVID-19 different from the seasonal flu? I think we all know now it's quite different than the seasonal flu. It's considerably more infectious. So it looks like it's at least 20 or 30% more infectious than the common flu. We don't know the complete answer to that because we haven't had community-wide testing that we have with the flu. Once we get community-wide testing, we'll have a little bit better answer. But I think based on what we've seen in other communities, it's more infectious than the flu. And then for many people, the syndrome that it causes is more severe than the seasonal flu. It's a little more unusual than the seasonal flu in the sense that for young people, it tends to be a very mild illness, and many young people don't even know they have it. Whereas in older folks, certainly over 60, we're seeing a mortality rate that's much, much higher than the flu. So it's quite different than the seasonal flu, even though it's spread in a similar way. All right. Will COVID-19 impact my access to insulin and other diabetic supplies? That's a two-part answer that I'll give to that. In terms of the supply chain, that should have no effect. There's 3 primary insulin producers in the world, and each of those companies have given assurances to us that there will be no problem with the supply chain. They have a big stockpile of insulin, and they have an adequate process to make more insulin, and they can ramp up. So we don't think that from a supply chain situation, there will be any issues with getting your medications. The problem that I see and many of us are worried about in the health community is that so many people now are losing their jobs. And when you lose your job, a lot of times you'll lose access to your insurance. And these diabetic medications can be very expensive, hundreds of dollars a month potentially. So I want to give a little bit of advice about that potential situation. So the first thing that I think you should do if you find yourself in a position where you're going to be losing your insurance is to call the manufacturer of your medication. Most people wouldn't think to do that, but many of these companies are realizing the crisis that's going on, and they're offering programs. So Lilly was the first to come out with that. They came out with it on, I guess it was April 7th, so just a few days ago. So they're going to cap the price of insulin at $35 for an individual. So it's way down from the absolute cost would be 10 or maybe 20 times higher than that. So it's a pretty good deal. And I suspect that the other 2 major insulin manufacturers, which is Sanofi and Novo, will have a similar program. So I would encourage you to call them, see if there's a program, because ideally you would stay on the same medication throughout this time. There's a worst case scenario where maybe you can't get access to these programs. The other thing that I would like to, tell you about is generic insulin. So this is human insulin, and I would never want you to change over to this without talking to your doctor. But I'd also want you to know that it's an option. Too often we hear about young kids, maybe just out of high school, they don't have insurance, they're not taking care of their diabetes because they can't afford the medications. Maybe they have a part-time job that doesn't offer insurance, and they end up with DKA or maybe even end up passing away because they can't access insulin. So in those extreme cases, this is a good option. This is human insulin. This type of insulin has been used for decades, from 1920 up until the 1980s or 90s. This was really the only type of insulin that could be used. So it's the same insulin basically that the human body makes, with just some very small changes to make it either Novolin N or Novolin R. And you can buy this insulin, 1,000 units, at most of the pharmacies for about $25, and you really don't even need a prescription to buy it. So this is a safety net that exists out there. Of course, it's not the ideal situation, but it would be better than nothing. And of course, you'd want to consult with your doctor if you're going to do this about how to switch over your doses. All right. And then this is the final thing that I'd like to talk a little bit about. And that's, what are your rights for workers with diabetes during the coronavirus pandemic? Now, many people with diabetes might not know that diabetes falls under the Americans with Disabilities Act. That means that employers are federally mandated to offer reasonable accommodations for people with diabetes. So that can mean a lot of different things in a lot of different circumstances. But in the coronavirus pandemic, that means people on the front lines, if they do have diabetes and they consult with their doctor and are felt to have a high risk of getting a severe infection, should change their job. This week I've written letters for nurses so that they don't have to be directly facing patients. I've written a letter for a grocery clerk. So instead of checking out, hundreds of patients a day, she can work in the back stocking shelves. So you have options. If you feel like you're at danger at work, don't hesitate to contact your healthcare provider, and we can work together and, work with your company to find a safe place for you to work. So those are all the slides that I have prepared, but I'd be happy to answer any questions that you might have.
Great. Well, thank you so much, Dr. Mosha. That was really helpful information. A lot of things that I didn't realize either. I wouldn't think of, if I lost my job, first calling a drug company to actually talk about, a reduced price for any drugs that I might be on. And it's great to know that doctors like you are also helping workers that are on the front lines, be that a grocery store worker or a nurse, to try to stay safe in their current job. So what an advocate you are for them. Okay, so we do have a question, and it has to do with, like, if you're in one of the higher risk categories, and what precautions should you take if you want to go outside to still walk or get some exercise? Is there anything that people should be doing, or should they not be going outside at all?
Well, that's a great question. We would go for a walk pretty much every day down to the old mill, and so we see a variety of people. I think if you're in a high-risk group, exercise is still important. So I would encourage it. I would encourage you to wear a face mask, though, when you're out on your walk. And I would just encourage you to try to keep 6 feet away from the people that you pass. I think if you do those two things, it should be very safe. And I think the benefits of walking, outweigh that small risk of potentially getting an infection. And I think the risk is very, very small if you're covering your mouth and keeping your social distance.
Great, thanks for that information. I walk my dogs every day, but I was thinking, being outside, that I didn't need to wear a face covering. And you're saying that we should, even outside, even if we're maintaining good social distancing, that we should still cover our face with some sort of mask or something. Is that correct?
I think it depends. So I personally don't cover my mouth when I'm with a mask when I go out. I feel like I'm in a pretty low risk group. But if you're in a high risk group and you're really concerned that if I get an infection, this could be a life threatening event, then I do think wearing a mask, the inconvenience of that, the benefit outweighs that inconvenience.
Great. Thanks for clarifying that. That makes a lot of sense, right? In a high risk group, that you would take that extra precaution even outside. Excellent. Well, I do not see any other questions from our audience members on Facebook or YouTube. So I just wanted to take a moment to thank you, Dr. Mosha, for volunteering your time to speak with us today and bringing this super helpful information and resources to people during this time. And for those of you watching at home, we hope you can join us next week. We have a great lineup of other live events starting on Monday. So go to our Facebook page to view the schedule of those. And all of these events are going to be recorded and available both on Facebook and YouTube, so you can share with friends and family members that you think would benefit from this information. And with that, I want to wish you all a wonderful Friday afternoon. And thank you again, Dr. Mosha.
No problem. Thanks.